despite all this access to data, right? Is it still sometimes the case that some leaders or some boards still have like this data aversion if it points to like a strategy or a course of action that might be hard to implement at an executive level?
Yeah. The first thing that happens when you present someone with data that they may not like or may be a challenge is they attack the data.
That's right.
Right? So we can talk about where'd you get it? I don't like the quality of it. Is that the right numerator? Is that the right denominator?
That's right.
We spend a lot of time talking about that. So if we get past that, and I mentioned making it actionable.
Yes.
If you have data and you don't do anything with it, again, you're better off not having the data.
Yeah.
And there was I'm going to tell a story that I shouldn't tell because I was thrown
my
out.
favorite kind of story. Tell us.
I was asked to leave an executive's office. We were at a health plans doing a project where they had 75 ad hoc reports that were generated on a monthly basis. You may appreciate some of these things. Wow, and I said, let's go through for each one of these reports and show me where you change a care management protocol. Show me where you change a discharge. And all of them were explanatory in nature. We went through about 17 and there wasn't a decision that was made differently because of that data. And I said, well, let's try to go through this whole stack and maybe get to one decision you change. And that was when the medical director said, I think the meeting's over. But at the end of the day, the point is very valid that if we don't do something with it, having access to all the data that we can get out of Amazon and Google and Epic and Cerner and Infor and Oracle is irrelevant if we don't do anything with it, and if we don't have the corporate resolve to make hard decisions because of it.
Yeah, and if it doesn't affect change in any way, that's exactly right. Ben, I want to talk about data from a patient perspective, right? How much focus do you think is needed when it comes to healthcare literacy if industry participants, plans and providers, to help patients sort of better understand their options and make the best decisions for themselves?
Short answer is a lot. But David mentioned one thing around sitting on a lot of data and the appropriate outreach or the appropriate suggested action to a clinician. The same applies to a patient or a customer. And I think a lot about how you have to empower an individual in the terms that they understand and they care about. And I think the field of behavioral economics was very popular the last 5 years. We can generate these kind of nudges that go to the consumer, but if it's not at an 8th grade reading level, it just complicates things, and it's just not. It's ignored. It can even come across as paternalistic.